Folks, thanks for coming on the line with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45 minutes or so discussing one of the pieces of software, one of the tools that are made available to agents contracted with our organization without any cost. This is a tool that we contract with an organization, a company called CSG, to make use of it. And we are adding components to it on a constant basis. And we want to make certain that you're comfortable with the way the program works and that the tool itself can be of great help to you, not only in making certain that you have the carriers you need as part of your portfolio, but also a way to offer a complimentary Medicare supplement review to your prospects and clients, to make certain that you maintain your book of business and add to it, but also give you an opportunity to speak to additional product that is of interest to the folks in the Medicare space. We want to make certain that you have an opportunity to offer multiple programs to a single individual, and there's also some key components on how you can use this tool to cross-sell and enroll individuals as well. A bit of information about Premier itself, if you're unfamiliar with us. We are a national marketing organization founded in 1968. We're part of the Integrity marketing platform that has offices across the country. We act as an insurance wholesaler working with independent insurance agents, offering access to insurance companies with contracts at the highest possible commission levels, and recruiting contracts are available to those who qualify. As I mentioned, we were founded in 1968, so this past year we celebrated a milestone, our 50th anniversary. And we feel that's a great accomplishment in any industry and in any space, and it's a great leap forward for what began as a small family agency in rural Nebraska, who's become one of the largest entities of its type in the Medicare Advantage and Medicare Supplement space. And that's due to our relationship with both the carriers, but more importantly, with you as independent agents. We do offer a full insurance portfolio in order to bring about that growth and the opportunity for ourselves and our agents. And that includes Medicare programs that include Medicare Advantage and Medicare Supplement plans, Part D prescription drug programs, standalone PDP plans, and an insurance portfolio with life insurance and annuity programs that include final expense and pre-need programs, long and short-term care plans, disability income programs, and ancillary products, dental, vision, and hearing products, critical illness cancer plans, and hospital indemnity programs. You'll be surprised by one of the uses of the tools on how that dovetails in very neatly with the base medical coverages, be it a Medicare Advantage or a Medicare Supplement plan. That Medicare Advantage portfolio includes all the national carriers and a large number of the regional programs that are available to you and can make a special difference for you in your particular market. That same philosophy carries over to the standalone PDP programs or the national carriers that generally are Medicare Advantage plans that offer standalone Part D programs as well, and in addition, standalone prescription drug programs as well. You'll see that the Medicare Supplement portfolio is very broad, very expansive, and we do offer different tools, such as the one we discussed today, that can make this a very viable portion of your insurance practice. Your agency can really benefit from having a portfolio of products that address the entire Medicare population and not just one segment of it. The ancillary products include the leaders in those respective fields of programs, and it's an awesome way to not only fully cover your prospects and clients, but also establish additional revenue streams and increase persistency by having more than one program in a household. When we look at the Medicare market overall, you don't come on a program like this without a marketer or a carrier speaking to the aging of the baby boomers, 10,000 people plus aging into Medicare. That's true, but it's only a subset of the true opportunity that we have in the Medicare space. The growth of folks that are over the age of 65 is very important, obviously, but there's a portion of those folks that continue to work and don't access the entire benefit package with Medicare. But there's also about a sixth of the population that are on Medicare programs that aren't 65. And those are the folks who qualify for that coverage on a disability basis. And that's one of the reasons why such a diverse Medicare population has us looking at different programs to cover different individuals according to their particular need and ability to pay in many circumstances. You see a population that has a number of chronic illnesses, 2/3 of the population have 3+, and half the population tend to be a bit limited when it comes to their income and savings. So there are different things we need to consider in order to properly address the needs of this population, because as they age, as we all age, our bodies change and so do our needs. And we want to make certain that we help you cover those circumstances. And we do so in a fashion that is within a budget. We are all in this for the long haul, and the renewals are a very important part of our financial situation. So we want to make certain that we do things appropriately in order to serve the Medicare population, because they have choices. First off, if they go just on traditional Medicare, they can self-insure. They don't have to do anything else. But most of them will look at some additional coverage to take care of the shortfall of the base Medicare coverage. So they'll pick up a Medigap policy and possibly a standalone prescription drug program, or based on their income and needs, may look at the private administration of their Medicare benefits through an MAPD program. So they have those choices, and the tool that we'll address today speaks to each of these choices. And we're seeing folks as they age in, according to DEFT research, they're making kind of an even split with how they choose their coverages moving forward. And if we take into account the financial status of a number of this population, offering a program that may be $200 to $300 a month in premium may not fit their budget in accordance to their needs either. So we want to make certain that we do things appropriately. This tool will help. The government also gives us certain dictates as to when we can help people. We have the standard election periods, but throughout the year, we have different special election programs that allow us to change a portion of their coverage. Keeping in mind that Medicare Supplement programs are not locked in. You may have certain constraints based on the state in which you market, where there might be a birthday or an anniversary opportunity that changes the availability of some of the programs. But this will refer to the additional needs they may have with their prescription drug coverage or an MA plan and the opportunities to change it. So when we look at this particular tool, we're looking at a program that is available, as I mentioned before, without cost to our contracted agents, and is located on our website at www.premiersmi.com. Why I do those 3 W's, I don't know. But you go in the sales and marketing portion, you pick the sales systems, and it'll pull up the quoting tools that are there for your use. It also speaks to our Medicare Center program for Medicare Advantage programs, but hey, that's a different webinar. You can access that then once the account is set up. If you don't have it initially, you can request it here. It'll kick your request to the marketer with whom you work in our organization so they can verify you have a contract with us. That is the prerequisite. Obviously, if we're providing a tool without cost, we need to be able to cover that cost in some circumstance. And it'll give you a variety of options available as part of that tool. Keep in mind, we're giving a little bit of a snapshot overview. We're going to do an actual demonstration of the program in just a moment as well. But it gives you access to Medicare Supplement programs, some significant details on Medicare Advantage and PDP programs, including a way to cross-sell within that program. And we've added an eApp function for select Medicare Supplement programs that you can actually enroll through this system as well. We've given a number of the different trainings for those programs, so we're not going to deal with that in great detail, but the follow-up to today's presentation, which is being recorded and will be sent to everyone who RSVP'd for today's meeting, will include a link to the practical demonstration on how you use that eApp function. You also then have quoting tools for a number of the carriers in the final expense world, in the hospital indemnity programs, and dental programs as well. When you look at Medicare supplements, it asks for some base information. And trust me, if I can use this, you most certainly can. I'm not very technically adept, but it basically asks for a way to find out where they live using their zip code. It'll ask for the individual's age, whether they're a boy or a girl, whether they partake of tobacco, and then the plan type that you are looking to quote, the effective date, and if a household discount applies. Many of these programs, depending upon the carrier, may have a discount even if there's only one person in that household that has a policy with a particular carrier. Some will allow a household discount as long as there is another individual in that household over the age of 18. Some may even allow that discount if the folks in the household aren't even related. So there's some neat ways of doing some of the pieces that come with it. When we get into the practical demonstration, we'll go into this in greater detail. Same sort of thing falls into the category of the Medicare Advantage and PDP programs. This is actually a function where you don't want to use this in comparing programs, but going into greater depth as to what all is entailed with the Medicare Advantage programs and a way to cross-sell with some hospital indemnity programs as well. This is a function that is newly added where if you are familiar with this type of quote engine in the past, they used to have you kind of look up a condition to see if a particular carrier would allow for underwriting, let's say diabetes or cardiovascular difficulties or a number of other health afflictions that may or may not preclude that person from actually obtaining the policy. This is a really neat piece that we'll go to in greater detail in just a moment. The final expense program gives you an opportunity to offer that inevitable need at the end of our lives, and a great way to go through and work rates for that. Same thing with hospital indemnity and dental programs. So let's take a moment here, and I think this might well answer a number of questions that might be popping up now, including an individual who can't see the dental coverage. I think that's something that I'm going to address on a one-off for you to make certain that we have a current link for you in that, so you're accessing it with all of the bells and whistles on it. So let's take a peek. Bear with me a moment. We skipped past the initial piece because I'm already logged in. I've been working with the tool here today, but it gives you then a number of choices, as I mentioned before, and that we went through in a bit of detail on the options within the program. But let's look at a very common use of the quote engine, and that is with the Medicare supplements. Let's take, and this is my home zip code, and since the world revolves around me, we'll use it. That was said very sarcastically. We're going to look at rates available to a 65-year-old female living in Lewisville, Texas, with an effective date at the 1st of July. And we're going to take into account some of the changes brought about by MACRA. We have a webinar on that next month, so tune in for that one. Give you an idea of some additional details on how you can make that 2015 legislation work for you. And let's look at a Plan G. We're not going to apply the household discount to begin with, but let's take a peek as to what pulls up then for us in this part of Texas. And this gives you an outlay of the carriers offered by our organization in that zip code with some specifics. I've got this actually laid out for greater detail that if you don't have the market analysis on it, it's basically giving you some specific information about that carrier. Let's scroll down and look at the kind of a mid-range product. Well, most folks are familiar with Cigna Health. Looking at that, we see that Cigna offers a G plan for $111.86, a decent rate. It gives you an idea as to the AM Best rating for this organization and the fact that it's rated according to attained age. We're looking at a Plan G. Standard & Poor's rating is not applicable for this particular carrier. You'll see that it isn't for most. And it also gives you then the opportunity to look into plan details, which basically is almost a CMS guide of choosing your Medicare supplement, which goes through and discusses what Medicare pays and what a Plan G pays, and then what is left as the financial responsibility for the beneficiary. It then also gives you an opportunity for this carrier to pull up a PDF of a paper application should you choose to do so. Sometimes that's helpful in order to make certain that you answer questions. Many of the programs now are really looking to have agents do applications on an electronic basis, which is a little different path than some of us had followed. But once you get used to it, boy, it really speeds up the process for you and your prospect, and it cures that challenge that many of us have when it comes to our handwriting skills. If you go to the carrier resources, that actually takes you to the website of that particular carrier, so you can access all the material that's available to you as a licensed agent with that particular carrier, and in many circumstances also gains you access to that electronic enrollment tool provided by the carrier. That piece that I had on here earlier gives you market analytics across the board for these organizations. That then gives you the opportunity to see what the rates are as the person ages, how it's banded based on different ages. You'll see that, well, Cigna, for its rating purposes, has a 3-year band to start where you're paying the same premium at 67 as you would at 65. And then it changes at 68 and then again at 69 based on aging into the program. It then also gives you the information that enables you to look at rate changes based on basically loss ratios, where Cigna in this circumstance has been very good about maintaining the increase of the costs of the program. And part of that is based on, well, gee, why doesn't it stay flat? Well, they've had claims, obviously, but you also have medical trend that affects the Medicare or the premium of these programs as well, because the cost of services go up. And let's think about it. For those of us who might be in my age range, I'm a little older than I care to be anymore, but 20 years ago, 30 years ago, some of the medical procedures that are available now weren't even discovered. And those tend to be very expensive procedures as well. I remember in high school, a buddy of mine having his knee operated on. They splayed it open. Orthoscopic surgery came in not too long after that, and it's a different world now, both in the recovery times, but also in the costs of those procedures. This also gives you information based on state and national premiums that are in play, and this gives you an idea as to how some of the increase history may come about. Some of the smaller organizations may not be able to weather some adverse claims history where some of the larger ones can. And I'm looking to go down to the largest Medicare supplement organization in terms of membership and premium and give you an idea as to some of that differential. Let's look at a difference here. Transamerica, a named carrier and recognized by many in the insurance industry, a strong program with a healthy annual premium of $174 million into their Medicare supplement programs in a 4-year market. Then look at the organization that has a third of the population, and you're going into billions. You'll understand then perhaps why AARP is able to accept folks with only 3 medical questions, and a little bit different animal than what we have with some of the other organizations that don't have that financial freedom, in a manner of speaking. When we look at some of the medical filters that are available, let's look at it this way. This is a nice piece on it where, once again, let's go back to that same subset. And let's look at some of the advanced opportunities we have. Here is then where you can use those underwriting filters to help make certain that we are quoting programs that the individual can actually qualify for. So it gives you the opportunity to go in and speak to different health circumstances. And let's just pick any heart disorder, any medications that they're on. You can actually plug in the different medications and some of the challenges that come with it. And so we've got, let's say, person with heart disorder, and they're also taking albuterol, so they got a little challenge breathing in certain circumstances. And then when we go in and look for a quote, we're looking at something that's a bit more specific for the individual that we are looking to provide coverage for. Come up in just a second, and it'll give you then how some of these organizations, carriers, address those circumstances. So it's a great way to make certain that you are offering programs that can be helpful to the individual, not just teasing them. You can then take these quotes and print them. You can then download them into a PDF format, which will give you the opportunity to have them in a file if you're one of those individuals who still do paper. And it lays out an opportunity then for you also to communicate with your prospect electronically with emailing these to the individual. And that's a great way for you to actually add to your marketing database and work those folks, if they buy from you or not, into a regular newsletter and other communications. So it's a great way for you to make that available in that circumstance. Basically the same view that we have. You can actually remove certain carriers from that, and you can compare a number of carriers based on, okay, these are the 3 choices, top 3 choices I want to make available to the folks I visit with. You can add the household discounts, and that will obviously change the quotes as well. It'll think about it for a moment. Believe it or not, that music you're hearing in your head is the theme to Jeopardy. And you'll notice how it affected the cost of the programs as well. As we are in a bit of a period of flux, or if you are looking to explain the differences between the different Medicare supplement types, it also gives you the opportunity to perhaps demonstrate the value of another type of plan as well. So you can take and save those different quotes, and you'll notice the change in the premium as it dictates. This also gives you the opportunity to download these quotes in an Excel format as well. I'm going to think about it for a moment. And this then gives you a different view. Some folks are more comfortable with more of a picturesque view of like what we have here. When we look at this, it comes out in basically an Excel format when it's done thinking, and it looks entirely different. Thinking. It's downloading quite a bit of data, so it'll take a bit of time. Sorry, I'm operating on two different screens here, and it popped up on the other one. So it lays the things out for you in this manner. And some folks feel that's a little safer, quicker way to demonstrate the differences between the programs, and it lays them out for all plan types this way as well. So you can look at the different detail with the different plan types and how that comes about for you. So you have multiple ways of preserving the information by using the tool. That then gives you the opportunity to look at the different carriers that are most price competitive in your market, and it gives you also a way to go in and speak to your prospects and clients on the different options that they have available, the different plan types, and what makes an F different from a G and why that cost is the way it is, simply by going through and using the quote tool to do it. When you look at some of, the other tools and the other products that are available, this gives you a little bit of a different perspective, but it is also very effective for the folks who do market a lot of Medicare Advantage programs. It will give you the opportunity to see all the plans that are available in your particular zip code that you've designated and lay some things out based on premium. Keep in mind, this doesn't compare all the factors of network and some of the other things that come into play with ancillary benefits that are very important to people in this space, but it does give you an opportunity to look at ancillary programs that might help you when it comes to adding the additional ancillary products for a person who is very comfortable with the plans that they have, but might be a prospect for additional coverages. Because when you look at, and bear with me a moment, let's go in this particular market, United Healthcare owns a good portion of the market. And we'll look at the plan details using this as an example. And you'll note here that it gives you an opportunity to fill the gaps. When we do that, it speaks to the need for the other demographics. Since MA programs are not based, the benefit package isn't based on an individual's age or tobacco process, we want to, however, gauge it properly to the folks that we look at. This is going to run a hospital indemnity program quote that will dovetail into the needs that are left behind for a Medicare Advantage plan. We can see in many circumstances that it gives us different options. So if we have a Medicare Advantage program that has a 5-day daily copayment for hospitalization, we might want to look at a particular company with that benefit and see what that program will run. It gives us then a very valid way of fully covering an individual based on the out-of-pocket exposure they have with their base coverages. So it's a really neat way, and it's taken a while to think here. But it gives you then the cost of that HIP plan to fill the holes based on that coverage. So the base program with the Medicare Advantage prescription drug program is a zero premium program with a max out-of-pocket of $4,900. What drives a person to that max out-of-pocket most frequently? Generally, that's a hospital stay dictated either by a specific illness, which may be a way for you to also speak to cancer programs or critical illness programs, heart attack, stroke programs. But that hospital stay is a big piece of it. And this then enables you to do a base policy to cover those hospital copays, as we've seen, and then even add in additional coverage where that $200 coverage for the ambulance cost them $2.40. Add in a little bit of lump cancer. That didn't sound good, but I think you know what I mean. It gives you then the opportunity to cover additional expenses. Because if you look at the Clint Eastwood view of a Medicare Advantage program, the good, the bad, and the ugly, well, good, well, gee, there's no premium that incorporates in the drug benefit, which can be good and bad. But what is the holes that are available? Generally, it's those hospital copayments and the coinsurance that an individual has for therapeutic radiology. Many of these programs cover that as base Medicare does at a 20% coinsurance, and so having a cancer plan can help make up for that piece as well. You'll also see the programs have some financial liability for additional services too, like durable medical equipment. But this then gives you the opportunity to look at and fully cover different pieces of that program and still come out substantially less expensive and perhaps more amenable to our client or prospect's wallet. So a great way to come in there and look at different things and make that work using a fill the gap scenario with the Medicare Advantage program. This does not yet have that sort of ability for the Medicare Supplement plans, but it's a great way to come in and look at different options in this space where a person's perfectly satisfied with their base coverage, you can't move them. Well, let's fill some of your holes. When you look at the eApp process, there are 2 carriers at present that allow you to walk through this. As I mentioned before, I'm going to send along the link to the 15-minute recording of this application piece to make certain that it works for you. And let's look at a couple of the other pieces that come into play here then for you. Final expense. When we look at these, it's, once again, based on where the individual is, if they're a tobacco user, and the face amount that comes into play. Using some of that same criteria, it'll pull different opportunities for you with different carriers based on what you're looking to quote, plain and simple. So it doesn't have every final expense carrier in the world in there, but it has, United of Omaha, which is a very popular carrier in order to fill that need. Hospital Indemnity, the same way, giving you an opportunity to quote just that coverage as well. That same individual. And it gives you a way to start at the bare minimum of coverages. Obviously, you're looking at a base plan here with a hospital confinement of $100 a day, a couple of little extras, and it's a whole lot of nothing when it comes to premium. And that can make a difference for folks that have a family history, perhaps, of hospitalization, or otherwise recognizing the need for additional assistance in that area. When you look at the dental program, and we'll make certain that any of you that may not have this as part of what they're looking for to go through and look at different quotes here too. It does not have all of the carriers either. We're having coverages and carriers added to this constantly, including one that rolled out here this last month. So we want to make certain to run through this as it's updated too. There are obviously different ways of making this work. When I'm going through some of the features here, I want to make certain that you're aware of where they are. How you use them is a critical piece of the value to this tool, including the household discounts and other pieces that are there. Working on the conditions filter is a new piece for us as well, so we want to make certain that that comes into play for you. Bear with me just a moment. Let's go back. So that gives you an idea on some of the different pieces as to what's available for you in different areas with different products. A great way for you to then go in and make certain that you are discussing the differences that make you different than the other agent down the street as well. So you've got some different things that can come into play there and work in your stead. Let's see here. I think we've gone through quite a bit of it now. I apologize for not being as thorough in some of the underwriting filter pieces as we could be, but that's new for some of us too as well. So let's look then as to how that can obviously be both a tool of recognition for you to make certain that you have the carriers in order to be competitive as an independent agent, but also a marketing piece that you can use either beforehand in preparation for an appointment or live in a person's home based on parameters that you want to have set as to what you show an individual and how you make it work to have it a viable tool in the house. Some areas without internet access, that would obviously be a challenge, but that's part of why you want to prepare ahead of time. As I mentioned, that eApp platform is being added as we speak. Carriers added on as we can work them into the concept. So you have Aetna and Mutual in there now. It's important to note, of course, that you want to not put all your eggs in one basket, hence the different products that are available on the tool and using that cross-selling component. Some of the other things that we can do for you as a agent with Premier is offer some additional support. So as you run across those different HIP programs or dental programs, some of them require their own online contracting process. Some of them allow the use of this software package, which enables you to create an agent profile and then select carriers to contract with electronically, where it auto-fills the contract for you. Makes it much simpler in the long run. We also offer discounted errors and admissions coverage to our agents. This gives you an opportunity as an independent agent to make certain that you are covered and satisfy the requirements of many of the carriers as well, regardless of whom that contract is through. There are some organizations that may add you to their blanket E&O for certain carriers, and then you're kind of in the woods for the others. This is a great discounted program that covers the full variety of insurance products and makes certain that you have done the due diligence you need to in order to protect yourself and your agency. We also offer discounted continuing education programs through our affiliation with WebCE. And this is a program that enables you to add to your own benefit package with a discounted, modified, guarantee issue disability income program that allows you to access that coverage at discounted rates, and you share in the commission of that program as well. This presentation is being recorded, and in the past presentations, we record them with regularity as well. So you have the ability to access that library of past informational programs through both our website at premiersmi.com and through our YouTube channel as well. That electronic access, once again, to that quoting tool is made available to you without cost with a contracted carrier with our organization, and gives you that variety of access for a number of programs. The Medicare Center program is something that if you work the Medicare space, particularly the Medicare Advantage and prescription drug place, you really need to be made aware of, because it gives you the opportunity to obtain the compliance materials electronically and store them for you. I am, of course, referring to the scope of appointment. There are different changes in the regulations that require you on how far ahead of time you need that now. You don't need the 48 hours. You just need to have it completed before you do your presentation. This allows you to collect that electronically and store it compliantly as well, and also allows you personal URLs that as you send out the information, you're able to do that, push the marketing information, the pre-enrollment kits, and the information the person needs for you to have a compliant conversation electronically. And it also gives you the opportunity to enroll them electronically in that fashion as well. Great tool. Can serve as a CRM as well. You load your data in there, your year-over-year evaluations, both for your clients that you have on a regular basis and for the folks that you missed. The prospects, it is giving you your information. It allows you to reach back out to them in a compliant fashion and reevaluate their choices year over year. We also have a program that allows you to put your social media marketing on autopilot through our Coverage Made Easy program. And we want to make certain that you're able to access all of the rewards for your hard work through the different carriers in our organization as well. So a consolidation of all the carrier trips and incentives that are made available. A lot of the Medicare supplement programs are now doing bonus programs, incentive programs for production in the Medicare supplement world. And those, along with other programs, allow you to access our production cruise as well. Last year it was to Jamaica. This coming year, it's a cruise from Miami to the Bahamas. So if you're one of the sun worshipers, this is a trip to aspire to. We do offer you additional ways of getting in front of individuals. That includes a contact list that is available to you that's butted up against a do not call list that allows you to cold call for the programs that allow you to do so. Medicare supplement programs, all save one, allow you to cold call, but we are seeing a number of agents use that for demand products like dental programs, where it's a straight, hey, new dental program in your area. Are you interested in some additional coverage information? A number of folks do this for final expense, and there are the folks that still do this for Medicare supplement programs as well. A lot of folks will chase it for the T65, but it also gives you the opportunity to access folks that are targeted a bit differently in that demographic. Let's say a 67-year-old that doesn't have the same marketing pressure and may already have seen an increase in their premiums in the first couple of years they've had it in play. So some different marketing strategies you can use that for. We do also offer different community-based marketing programs. Retail marketing is underway now. We've been through 2 rounds of store selection for the Walmart programs. There's another one coming up where a list will be available on the 24th of this month. The store is still available in that program. And then, of course, we have information for other programs available through different carriers, such as the program with Aetna and the CVS programs, the United Healthcare, and their variety of vendors that they use in that opportunity. We also have a tool available for you in approaching marketing circumstances with faith-based organizations, a way to make certain that either a camp or a informational seminar is made available to a population that will respond to outreach in this fashion that may not any other type of media approach. Those presentations are pre-approved. We take many of them directly from CMS or carriers and make certain that we protect you with the information you're presenting as well to make certain that it's compliant. We also have a number of programs that help you reach out to the providers, doctors, specialists, hospitals, dentists, other providers of care for the programs that we offer through the insurance carriers. There are different carriers that will support production based on production with that carrier, and there are certain times of the year where carriers will make prospects available, leads available through their marketing efforts to the independent brokers as well. We do have a number of different internet lead programs underway, including a pilot program in our final expense area. If you're interested in that, we will make certain that our final expense department gets you additional details. And we do offer direct mail support based on production. You can deeply discount the cost of mail through one of our approved vendors. All this said and done, the reasons why we make tools like the Quote Engine and Medicare Center and other programs available to you, is we do want your business. We want to work with you, and the opportunity to earn that is what we're looking for here. And we want to make certain that it is a part of your overall marketing program. Remember this, the picture of the eggs and the money. We don't want all your eggs in one basket either. We want to make certain that it gives you a variety of approaches to be successful in your chosen field. It's up to you to put that into play, and we want to help with marketing programs to do so. All that said, you can reach any of the health marketers within Premier Marketing through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. I'm going to check for questions here. Information about accessing Medicare Center will be sent as part of the follow-up to today's presentation. We'll make certain that that comes to you. And let's check for other questions that may not have been addressed. Bear with me. Don't want to leave something unaddressed. I'm having some challenges here with our software. Oh, I think I got them all. If there is a question I missed, or in the circumstance for the individual who was having some challenges with the product that was being displayed on the quote engine, we'll make certain that we address that individually. Commissions on the programs do vary from program type and may even vary within a subset based on the different carriers that are available. But when you look at Medicare supplement programs, we see agent level contracts coming across at anywhere between 14 and 24%, depending upon the company, with different bonus programs there as well. When you look at the Medicare Advantage and prescription drug coverage, the increased amounts for those has been announced, the maximum for an agent, and that is controlled by CMS. I'll make certain that I include that as part of the follow-up to today's presentation. You will see varying amounts for commission on dental programs from 15, believe it or not, there's a couple programs out there with over 52% commission on dental. HIP programs generally vary from about 20 to 35%. So you'll see different commissions depending upon circumstances, carriers, and the product. We want to make certain that we're pretty forthright in all of that information as well. So all that said, I want to thank you for coming on the line with us today. We'll make certain that we address any questions that had been missed. Oh, there we go. And different programs obviously are available in different parts of the country as well. So we'll make certain that any of those questions as to availability is laid out for you as well. That said, thanks once again for coming on the line. We appreciate the time you spent with us today. And in the meantime, until we speak again, we wish you good selling. Thanks so much. Talk to you soon.